You know how it be. It's time for the latest Change My Mind. And outside of violent riots, there's one topic that is at the tip of everyone's tongue.
Even as the death toll in America continues to climb past 60,000, 2,000 new deaths a day, day after day after day.
If people have an underlying condition, it is exacerbated by the virus and therefore included in the death count.
Citing CDC data now reports that the U.S. death toll is actually far higher than what's been reported.
And you know what? I don't buy it. I think the death count is grossly overinflated, but what do you think? What constitutes a COVID death versus someone dying of COVID? And do you trust the media's reporting on the topic? Let me know in the comments below. On with the show, meet Drees. Well, I appreciate it. Here, you want to move in then so we can actually hear you?
Sure.
My name's Steven.
Hi,
Or do you want to do the
That's
social
fine.
distancing? Pause. Now, before all of you in the media and or the comment section say that I wasn't properly socially distancing, I offered every single person, including on this topic and the topic of America not being racist, the option of me wearing mask or going maskless. See for yourself. I'll put on my mask if you so desire.
No, I don't care.
You don't? All right, at this. Sure. Well, I come to the conclusion from a few.
No.
He's can you actually spell your name for me for the camera?
Drees, D-R-E-E-S.
Not Drew
Stop.
Brees.
No.
He's
not
been in
Drew
a lot
Brees.
of trouble lately for saying that we should, unify. So yes, I do believe. I think statistically, it's at this point, it's pretty hard to argue against the fact that the COVID death numbers have been inflated dramatically. Yeah.
Why? How do you come to that conclusion? I'm just curious.
Sure. Well, I come to the conclusion from a few. Oh, sorry, that fell. From a few numbers. Well, first off, let me ask you: Do you believe the current death totals that we have?
Shut the fuck up, Moomin, all right? It's a
I have no
stupid
idea.
fucking meme.
That's why I'm asking the question.
Perfect.
I don't know why you wouldn't think it is. I don't know why someone would lie about it.
Well, I think there are a few reasons that someone might lie about it or might be dishonest regarding that. And that's number one. Let's start where there might be an incentive, and then the statistics that might bear it out.
All right.
Hospital right now gets significantly more revenue if they have a COVID patient versus a non-COVID patient. If they list a non-COVID patient, for example, they might get $5,000 in revenue in some kind of federal relief, United States government relief. They might get up to $13,000 if it's a COVID patient. Now, I understand there are experts who've been on both sides. And
Is there a DRG code for COVID?
Yeah.
There's a diagnosis-related group code.
Yeah, there was.
for
My
COVID.
wife was just in the hospital,
Okay,
and they were
interesting.
asking her about it. Yeah.
Interesting.
As far as I understand, I don't know necessarily if it's a DRG code or a separate code, but my wife just came out of the hospital with GBS,
Because that's how
and
you
it was
do
a big deal.
It's a DRG code
Yeah.
if you're in a hospital.
Well, then that would be it.
I
'cause
know
they
a
had
lot
place
about
to film.
hospitals. Go ahead.
Great. So I do tend to agree with Dr. Burks that it's inflated up to about 25%, specifically at least 25%. And let me present to you why I think that's the case. In New York, are you aware of how many of the COVID deaths are actually just not tested at all?
No idea.
25%.
Okay.
No testing at all. In Colorado recently, they said, well, hold on a second, we need to get some more accurate data here because, as you know, listen, there's a lot of data that comes in, and I do reserve the right to change my mind because data does...
Fuck, hold on. I have it on multiplayer, so I can't pause. There's a couple important things that we need to go over real quick. So, number one, there are kickbacks to hospitals if you have a COVID-related patient. What's the prescription there that Crowder is suggesting? Ought there not be? Should a hospital not be compensated with federal funds if they've got to go through the extra precautions, the extra things that cost money? It costs money, extra money to like isolate patients and everything related to COVID-19 or the SARS-CoV-2 virus. Like, should we just get rid of that? Should a hospital have to bear those costs? Should there be no federal funds allocated? Like, what is your prescription for that? Because right now we're laying out like a descriptive trail where we're at the end we're going to say, well, look at all these things. Like, don't you think they're faking the numbers? But like, this needs to be demonstrated if we feel like that's happening. Okay, we're here for now. Okay, so the first thing is true. My understanding is that hospitals do
Shut
get...
the fuck up, Moomin, all right? It's a stupid fucking meme.
Nice. Hospitals do get a kickback for having a COVID-19 related death, but that's that's okay. That's fine. If you think that hospitals are faking it, well, we need some investigative journalism there, or we need something to like actually demonstrate that. We need to see evidence of that. We haven't established that just because there's a federal kickback for that means that hospitals are necessarily faking the numbers. So that's number one. Now, I understand we're setting our case up, but...
present to you why. I think that's the case. About it.
Also...
As far as I understand, I don't know necessarily if it's a DRG code or a separate code.
Hold on. He's about to get us
I do tend to agree with
Shut
Dr.
the
Burks
fuck
that
up,
it's
Moomin, all right?
inflated up
It's
to
a
about
stupid
25%.
fucking meme.
Specifically, at least 25%.
Hold on.
And let me present to you why I think that's the case. In New York, are you aware of how many of the COVID deaths are actually just not tested at all.
So for a lot of the COVID related deaths, they're not testing these because they just don't, especially initially, they just didn't have the testing kits to do it. The people that are responsible for making the classification of whether or not the death was related to COVID-19 or not are trained people at like the mortuaries or people at that are involved with like, I don't know what you call the guy that actually declares time of death or whatever, but there's like groups of people that are involved with this that are supposed to be able to identify, was he suffering from COVID-19 related illness or did he have symptoms or whatever, and then can we classify this as a COVID-19 death? They just don't have the testing kits for all of these people. They just don't. Also, what Stephen Crowder's probably not going to mention is in the very, very early stages, there were a lot of extra deaths that were happening that weren't tested at all and weren't declared COVID-19. That might have been, but we just have no fucking idea because we didn't have the testing kits available and people weren't allowed to declare them as a COVID-19 related death either.
No idea.
25%.
Okay.
No testing at all. In Colorado recently, they said, well, hold on a second, we need to get some more accurate data here because, as you know, listen, there's a lot of data that comes in, and I do reserve the right to change my mind because data does change, especially in the pandemic.
And there's a lot of deaths.
Right. There have been a significant amount of deaths.
Are you telling me
in
that...
Colorado,
Okay,
in Colorado, they decided to finally differentiate between deaths from COVID and deaths with COVID because, like New York, every single death where COVID was found in the system was being counted as a COVID death.
Correct.
So they said we're going to differentiate that.
That makes sense.
The death total came down by, and they're the first state that did that. Colorado. The death state was reduced by how much, do you guess?
I don't know, 25%.
25%. Every single death from nursing homes in the last several months, every single death, regardless of a test or not, has been listed as a COVID death in the United States.
I wonder if that's actually true. Hold on. I like how he doesn't make any of the links clickable, so you literally have to type in the fucking link. Let's see if we can find that. Every single nursing home death counted as COVID-19 death. Minnesota is the highest percent of COVID-19 deaths in long-term care facilities in the nation. 81.7% of Minnesota's COVID-19 deaths were in nursing homes and residential care communities, the highest percentage state in the union. According to their data, so stated reports 537 deaths at a total of 6 long-term care facilities. Infectious Disease Division Director Chris Arisman told the Center Square that the state's long-term care facility COVID-19 death rate is higher in Minnesota because of aggressive testing. Our focus on long-term care means we will have more deaths because we are testing in the age group where we expect to see more fatalities, and we have now identified everyone as a case. So their death will count. Arisman wrote in an email. What that means is that if any of these long-term care cases subsequently die, they will be included in our death count. She wrote, if we had not been doing aggressive testing, some deaths would have been missed and not counted as COVID. Our aggressive screening and testing means that we are counting more cases and deaths than are missed. We don't know that is happening in other states. I don't think this is saying that they're counting every single death as a COVID-19 death. I saw it, Loki. I don't really care. I don't think this is saying that. Maybe he's misspeaking. Every single old person home death was counted as a COVID-19 death. That sounds like a pretty...
Death total came down by, and they're the first state that did that. Colorado. The death state was reduced by how much, do you guess?
Wait, hold on. The numbers probably are inflated, but it shouldn't matter with how high the numbers are and how little they're inflated. I mean, like, it's possible the numbers it might not be exactly correct, but every analysis that I've seen has shown that, like, the amount of deaths right now, there's a massive uncounting of deaths that are happening right. It's usually in the other direction, that we've, like, massively, or not massively, but that we've pretty substantially undercounted the number of people that have died because of either COVID-19 or inability to access care otherwise. It is saying that everyone who may have died of other causes but also had COVID-19.
Shut the fuck up, movement, all right? It's a stupid fucking meme.
Yeah, there's a New York Times article on this. So the hard thing is that, like, how do you not count that as a COVID-19 death? Like, how can you possibly make a determination for what killed? This is the problem with, like, comorbidities and shit. You should read the CDC article about how they calculate flu deaths. They don't use positive tests. That's only a fraction, about 1/3 of the total they give. They estimate it. Wait, can you link that? That would actually be really interesting. The New York Times has been doing tracking on, like, so basically they compare the average amount of deaths in prior years, and then they look at the COVID-19 stuff.
Shut the fuck up, movement, all right? It's a stupid fucking meme.
I guess if enough people die, hospital overcrowding will stop being an issue.
And you start to see that there's, like, a large amount of unaccounted, like, far above normal amount of deaths than what you would normally expect to see during this year. So people don't know. It might be COVID-19 related. It might be this was back when the U.S. had 68,000 reported deaths, 67,000 due to COVID-19, but we were excess in deaths of about 86,000, which is like 20 to 23% over what's being counted. Not to say that everybody died because of COVID-19. It could have been a slightly worse year. It could have been people dying from other things because they couldn't get to a hospital. Like, fact checker. Hospitals are reporting all deaths as COVID-19 related. In the last several weeks, many false or misleading theories have surfaced on social media about coronavirus and the response to coronavirus. We're taking a look at some of these messages circulating on the internet to see if there's any credible information to support it or to debunk it. Here's one that's popping up a lot. Hospitals are counting all deaths as COVID-19 related. This is similar to, like, all old retirement homes are counting them as COVID-19 related. I haven't seen that substantiated anywhere, but according to factcheck.org, many viral death was because the state has instructed that anyone who didn't die by a gunshot wound or car accident listed as a coronavirus victim. Experts said there's no such default classification, that the U.S. death count is probably underestimated. Factcheck.org says there's no evidence that any state has adopted a policy to classify all deaths, regardless of individual circumstances, being related to COVID-19. Sally Aiken, the president of the National Association of Medical Examiners, called the allegation ridiculous. Death certificates are basically federal, and each state has a public health division that answers to the U.S. Centers for Disease Control and Prevention for death certification. Aiken, the Spokane County, Washington medical examiner, told us in an email. For all practical purposes, death certification is directed by the feds via health departments. Some states and countries have added deaths as COVID-19 related after deciding the victim was suspected of having COVID-19. For instance, in New York City last week, officials reported 3,778 probable deaths where doctors were certain enough of the cause of death to list it on the death certificate, and 6,589 confirmed by a lab test. The change in the city's accounting of deaths came after officials acknowledged the statistics based only on laboratory confirmed tests were failing to account for many people dying at home before they reached a hospital or even sought treatment. One of the problems was under-testing deaths in the beginning. How the CDC estimates the burden of seasonal influenza in the U.S. How the CDC estimates influenza associated hospitalization, illness, deaths. The methods to estimate the annual number of influenza-associated deaths have been described in detail elsewhere. The model uses a ratio of deaths to hospitalizations in order to estimate the total influenza-associated deaths and the estimated number of influenza-associated hospitalizations. We first look at how many in-hospital deaths were observed The in-hospital deaths are adjusted for under-detection of influenza using methods similar to those described above, or hospitalization using data on the frequency and sensitivity of influenza testing. Second, because not all deaths related to influenza occur in the hospital, we use death certificate data to estimate how likely deaths are to occur outside the hospital. We look at death certificates that have pneumonia or influenza causes, other respiratory and circulatory causes, or other non-respiratory, non-circulatory causes of death, because deaths related to influenza may not have influenza listed as a cause of death. We use information. So this kind of like guesstimation or whatever is like pretty common. I don't think you can test every single fucking patient dying. Why doesn't the CDC base its seasonal flu mortality estimates only on death certificates that specifically list influenza? Seasonal influenza may lead to death from other causes such as pneumonia, congestive heart failure, or chronic obstructive pulmonary disease. It has been recognized for many years that influenza is underreported on death certificates. There may be several reasons for underreporting, including that patients aren't always tested for seasonal influenza virus infection, particularly older adults who are at greatest risk of seasonal influenza complications and death. Even if a patient is tested for influenza virus infection may not be identified because the influenza virus is only detectable for a limited number of days after infection, and many people don't seek medical care in this interval. Additionally, some deaths, particularly among those 65 and older, are associated with secondary complications of influenza, including bacterial pneumonias. For these and other reasons, modeling strategies are commonly used to estimate flu-associated deaths. Only counting deaths where influenza was recorded on a death certificate would be a gross underestimation of influenza's true impact. Are you going on scuff tonight? If Train asks me, I probably will, but we'll see.
I don't know, 25%.
25%. Every single death from nursing homes in the last several months, every single death, regardless of a test or not, has been listed as a COVID death in the United States. 25% of all deaths in any given month in the United States come from nursing homes. So when you look at all those numbers in tandem, and you see how every death, or in most states certainly, except for states like Colorado, death with COVID in the system is being counted. And as we revise those numbers, there seems to be good reason for experts like Dr. Birx, and I mean, there are several experts on all sides, obviously. We had experts who said we would have 2 million deaths from the Imperial College in London.
So deaths that with COVID in the system, like I don't think COVID-19 can kill you. I don't think just having a virus in your body typically doesn't kill you. It's usually secondary things afterwards that cause you to die. So, for instance, like pneumonia, the condition of pneumonia brought on by COVID-19 is generally what's going to kill you. Or it could exacerbate other issues, like things that could lead to like congestive heart failure or whatever, that could kill you. So to say like, oh, well, that guy had a heart attack. He didn't die. He didn't die from COVID-19. He had a heart attack. It's kind of like saying George Floyd didn't die because his windpipe got crushed. He died because he had, I forget the exact term, but like it was basically a heart attack as well. That is, his heart couldn't pump blood through his body. That's what killed him. Well, kind of. Much the same way that like the reason you died was because blood stopped pumping to your brain. Well, but also because I used a shotgun and shot you in the face, I mean, like, it's kind of true, but not really. Like, that doesn't really make sense.
And Neil Ferguson, I believe, had to resign. I think there's a pretty strong case to be made at this point that the death totals, which are the most reliable indicator we have been inflated.
So let me ask you a question. How would you confirm?
Would you mind moving in a little bit?
Sure.
'Cause I don't think anyone
After
can
a
hear.
death, how would you confirm that it was COVID? Do you do an autopsy? What do you do?
Yeah. Well, we should at least do that.
No,
at least do
what
something.
is done?
Well, right now it's just a COVID test. So in other words, if it comes up...
So Crowder is not even correct. They don't actually test everybody that dies, or unless he might be able to say it, but they don't actually test everybody that dies, especially in the beginning, and especially in some areas. They just don't have access to all of these tests. They can't do it. So oftentimes what happens is it's just like a coroner or somebody working that makes a guess based on the symptoms available and the best known stuff available. They can't always test every single body. They can't autopsy every single body sometimes to figure out, like, well, how are you dying? I wish there was an article that I had on this a while ago. I'm not going to be able to find it. Fuck. I read this on my computer. What would it have been called? Mortuary? No. Morgue? Guidelines for reporting this, inflating the numbers. Autopsying everybody would be so labor intensive. Yeah. Okay. Sorry, here it goes. On April 3rd of 2020, the CDC's National Center for Health Statistics issued guidance to physicians, coroners, and medical examiners who fill out death certificates to list COVID-19 as an underlying cause of death in the absence of a test if the circumstances are compelling within a reasonable degree of certainty. The guidelines specify in cases where a definitive diagnosis of COVID-19 cannot be made, but it is suspected or likely, for example, the circumstances are compelling within a reasonable degree of certainty, it is acceptable to report COVID-19 on a death certificate as probable or presumed. In these instances, certifiers should use their best clinical judgment in determining that COVID-19 infection was likely. However, please note that testing for COVID-19 should be conducted whenever possible. Jensen's commentary contributed, is that the hospital that he cited? Or the doctor that he cited? Jensen's commentary contributed to a narrative promoted by right-leaning media outlets that the ongoing COVID-19 coronavirus disease pandemic is not as deadly or serious as reported, and that social distancing measures implemented to control its spread are unwarranted. Huge. Minnesota senator and doctor reveals HHS document coaching him on how to overcount COVID-19 cases, read one headline from the conspiracy site The Gateway Pundit. Experts, however, agree that COVID-19 cases in the U.S. are being undercounted, not overcounted, due to the lack of available diagnostic tests. I don't think in any case are we overestimating the deaths due to COVID-19. I think most likely we're underestimating, and in some cases we may be underestimating by a lot. Bob Anderson, who heads the mortality statistics branch at the CDC's National Center for Health Statistics, told us by phone. Anderson noted that medical examiners' offices in the hard-hit state of New York are overwhelmed, and that the state has had an increase in unattended deaths in which COVID-19 was a likely factor, but no tests were available to confirm. We're not asking healthcare providers to write COVID-19 down for everyone who is possibly exposed. We're asking only if the patient showed symptoms and they're reasonably certain the patient had the disease, Anderson told us. When the evidence tells you that COVID-19 was a likely cause of death, then you should report it as a likely cause of death, whether you run a lab test or not. And medical examiners, physicians, and coroners are trained to make these determinations. That's just how it goes. We don't have the resources available to test and autopsy and test every single fucking person. You can't do that. Especially in a time where we're already short on tests. You want us using those on dead bodies? Dude, it can't always be done. What's the prescription? Do we just not count any of them if there's not a direct test available? What are you saying we ought to do otherwise?
Positive for COVID, period. It's a COVID death. Let me ask you this. Do you believe that George Floyd had COVID in his system? Do you believe he died from COVID?
No.
Okay, neither do I.
Right.
And a mere few weeks ago, that certainly would have been registered as a COVID death. So it's tough because we don't have...
I don't know if that's true. I would be interested in seeing a source on that.
Statistics on every single COVID case. Here in Texas, actually, a good example. Are you aware of the first COVID death in Texas?
No.
When did George Floyd die? Was it weeks before this? Because his death wasn't... I don't think his death was listed as a COVID-19 death.
First COVID death was a 97-year-old who already had an underlying condition. I've been trying to search high and low for the underlying condition. Can't get access to it anywhere. I would list maybe underlying condition that he's 97. That could be one of the...
Okay, but this isn't how comorbidities work, right? This is the problem, okay? If you're dramatically obese and you've got a lot of heart, hypertension, if you've got heart disease, and then you get COVID-19 and you die, well, this is the, it's a legitimate question. It can be difficult to figure this out, but things complicate things. Technically, there's going to be a confluence of things that cause a person to die. It's not usually a single thing. The idea that, didn't he test positive for COVID? I think they said that he had the antibodies in his system or whatever, but I don't know if he still had it at the time, but, if somebody has heart disease and then they contract another disease and that kills them, it's weird to say that COVID-19 killed this guy, but he was already 97 and almost anyway. Okay, but that's a COVID-19 death, my dude.
Founding factors there, but go ahead. I know you have a question.
No. So what you're saying is there is no autopsy done routinely on patients that die who have COVID. Therefore, you can't really say whether they've died from COVID or something else.
No, that's not. I'm actually saying it's worse than that, in that there are definitive cases where doctors, health professionals know that the death is not the direct cause of COVID, and they list it as COVID anyway.
What are some examples of this?
Because you're saying because there's a financial incentive? Is that what you're
There's quite a few incentives. There's no doubt. I think we'd probably agree that it's been politicized for better or worse at this point.
Oh, yeah.
What a pointless statement. Everything related to the CDC and everything related to is going to be politicized.
If you don't believe 2 million dead. Remember, at one point they said, don't wear masks, you're anti-science. I was advocating masks when they said, don't wear masks. We actually started stopped selling them. We didn't actually sell them, but we had a sponsor who was producing masks, turned their entire factory for masks. We said it's good to protect other people. At this point, people like myself were being condemned by the CDC. Then they said, if you don't wear masks, you're unscientific. Right. Then they said lockdowns to flatten the curve. Well, not only do we flatten the curve, we put a lot of hospitals into bankruptcy and doctors and nurses out of business because we never had the same surge that we expected. We just had that.
So initially, it was recommended against wearing masks because they were worried that medical professionals were going to run out of masks, and the medical professionals obviously need them a lot more than we do, especially when it comes to things like N95 masks that don't help keep other people safe anyway. They're meant for contaminated environments. You exhale everything out of an N95. What was the second thing he said? Oh, so we put ourselves in lockdown, and then a lot of people died, or a lot of hospitals went out of business. So the scary thing right now. Man, dude, you have no idea how much I need to fucking get the fuck out of here right now, too. Like, I want to travel. I want to leave. But, where is the website? Somebody link me. The scary thing is that the lockdown probably did help, like, a significant amount. The lockdown probably helped a lot. And what we're really going to see is when we come out of this, when we come out of the lockdown, we're going to see what the impacts are on some of these states. Come on, load. This shit takes forever. Hold on. They didn't say don't wear masks. They just said don't buy the N95 masks that the medical professionals need. Yeah, sure. How do you think you do against Carter in real life in this format? Oh, if I knew the topic, he would get crazy. He usually relies on, like, tricks and people not being familiar with, like, gotchas that he looks for. There it is. So, like, as we see some states start to come out of lockdown, like, which one of these have come out of lockdown? Did Texas do it a couple weeks ago? Texas out of lockdown. Which states are reopening and when? What is this garbage website? Did I click something? Oh, I love it when websites have these side areas where if you click them, it sends you to some other dumbass place. Okay, May 22nd, January, February, March, April, May, June. So I think it's about 12 days after reopening. So in early June is about when you'd expect to see like a spike of cases. So like around June, if we go from the 22nd, so around June, like 3rd, June 4th, is about when you would expect to see cases spike up, about 12 days after. So it kind of seems like maybe the lockdown was helping. I think Florida is fully reopened now. I don't know when Florida decided to open. Florida opens. This is where all 50 states are reopening. Jump to state, Florida. Starting May 4th, restaurants were allowed to offer outdoor seating. Florida key business will be allowed to reopen to visitors beginning June 1st. And lodging businesses can operate 50% June. So maybe like 10 to 12 days. So like June 13th, June 14th is when you'd expect to see about 12 days after for Florida. So around here. And then we scroll down and we see in Florida, like it kind of looks like, it kind of looks like when you open, it looks like cases are kind of spiking up, right? Like, that's what it looks like right now. You can argue that, well, we have more testing available now or whatever, but like, is that really the reason? Because you've had cases rise and fall. Some of these places have said explicitly, I don't remember, was it Alabama that said we're not testing more people? Like, the amount of testing hasn't changed substantially. So like Utah, when did Utah say they were going to reopen? Was it sometime like in mid-May? Governor Gary Herbert issued an executive order that placed Utah under moderate risk protocols for COVID-19 beginning May 1st and will remain in effect until May 16th. Mid-May, right? And then we go back and we look at our chart, and it seems like about 10 to 12 days after mid-May, or maybe a little bit, yeah, you started to get a pickup in cases there in Utah as well, right? Like, I mean, I don't know. This is worrying. That's a worrying trend, I would say. Can you please link to the site? Yeah, sure. How is this surprising? Well, because a lot of people, that Rob guy that I debated too, a lot of people are making these statements that like lockdowns don't do anything. Like, just, they don't do anything. That doesn't seem to be the case. It seems like the lockdowns are fairly effective. And I'm based on the idea that when the lockdowns go away, it seems like the number of infections are spiking pretty hardcore. We're on the 18th today. Like, these are just rising. Texas is dramatically rising. 23. Wait, so this is like 23, 24, 28. North Carolina's is holding steady in terms of like rising at about 1,200 a day, but like Florida's dramatically increased. 15, 16, 17, 20, 22, 24. Where are you on the way Sweden handled it? I don't know. The jury's out on that one. They're still arguing back and forth on whether or not they had a good idea, but they didn't take care of their old people properly. If the idea was bad, period. If it was worthless, that like Sweden might be doing everything they can to protect themselves from economic harm, but they're still going to suffer economically a ton anyway because of all the other people closed down.
Shut the fuck
there's
up,
like
all right? It's a stupid fucking meme.
We won't know that until months and months and months from now. Probably till the end of the year, we won't know if Sweden's approach was good or not. Click, it shows you the curves. Do you think it's really reasonable to stay in lockdown until a vaccine is developed? It took 4 years for a mumps vaccine to be made after it first came out. No, of course not. I think that we should absolutely open way before a fucking vaccine comes. What we need is an appropriate amount of testing, and then like really aggressive contact tracing, and then really aggressive like social distancing measures. Seems like it's strange because we do contact tracing for like STDs in America. I don't know if we do it for, right? Is it considered contact tracing when like, if you like email somebody saying like, hey, somebody that tested positive for this disease is blah, 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 here's an email just to let you know. That's considered contact tracing, right? We do that for STDs in America. We don't do it for, I don't know if we do it for COVID-19 yet. We do it for tuberculosis too. Nice. Yeah, I don't know. We'll see. Do you think the pandemic has had a big impact on STD rates? I have no idea. Maybe. I'd imagine it would have some downward pressure on them.
That recently with my wife in the hospital. She had a minor procedure, and then she came out with GBS. I don't know if you're familiar, it's central nervous system damage, and she wasn't able to get the kind of care that she needed. She couldn't get a bed because they had to have it reserved for COVID patients. Right. She couldn't get an MRI done. It took a day and a half because the rule in the hospital was every single MRI machine had to be reserved for COVID, right, except for one. Do you know how many COVID cases they had in that hospital at the time?
Probably zero.
Zero. And so I do think that we need to look at the overall ramifications, and I think certain people haven't looked at all of the above, and the reason I think that they are inflating the deaths is because it's been politicized at this point, for better or worse. They want to blame the United States government for not being prepared for it, for the same reason they said 2 million dead, that they've advocated lockdowns and continued it. There is a financial incentive, and I think a lot of the time people just don't want to admit that they're wrong.
So conservatives, sometimes, if a conservative is given preparation, they're very good at constructing valid arguments. So remember, there are two ways to evaluate an argument. It could be valid or it could be sound, right? A valid argument is an argument whose conclusion logically follows from a given set of premises. A sound argument is an argument whose conclusion logically follows from a set of premises and whose premises are all true. given time to prepare, a conservative can construct the appropriate premises needed in order to have a valid conclusion. Oftentimes those premises will be fantastically incorrect. So if you want to debate a conservative on this, you have to know the facts, because if you give them the opportunity to just rant and rave, and then like throw all this at you at the end, generally their conclusion will logically follow. And given not knowing exactly what Crowder is talking about, or not knowing if what he's saying is true or false, if you don't know that, you're kind of forced to buy into the conclusion here, without much you can do in return or in response.
So when you ask, do they need to do an autopsy? I think at least doing that would be helpful. At
Not
least
possible.
Measuring these deaths as we do, for example, like the flu season of 2016 to 2017. 2016 to 2017 was the worst flu season I think we had. It might have been 18 to 19. And it was curious. It was interesting to me.
So what we just read about the CDC was that Crowder doesn't actually know how the CDC guesses flu deaths, because the CDC doesn't actually do an autopsy and measure every single death. They can't do that. They actually use statistical modeling for it as well. So Crowder's just completely unaware of that. He just doesn't know.
Because when I was looking it up, trying to find the worst flu season in the last 2 decades, this was me doing research, I saw a number keep coming up, 85,000 deaths from the flu. Turned out the number was 62,000. And the reason for that was because they revised that number and said, actually, these people weren't really dying from the flu. They happen to have flu in their system.
Right.
We're not doing that with
system.
COVID.
They died of heart attack or whatever.
Right. And I would even go and say, if someone has, for example, a mild condition, let's say like a heart arrhythmia, and COVID causes complications that abnormally they have a heart attack, that should be a COVID death. But we have such extreme cases and so many cases where it's clearly not coronavirus related or COVID related,
Like
and people
what?
believe these numbers wholesale.
Then I believe your argument. I mean,
Because he let him
the
set
gal's
everything
got the
up.
sign over there. I'm going to ask a simple question. Why do you think it's inflated? So
Yeah.
you think it's inflated, one, because there's no confirmation of anybody who's died with COVID that COVID caused it.
No, not anyone who's died. There are many where no tests have been conducted at all.
Which is reasonable.
That's my point.
Yeah, but you said we haven't had confirmation with anyone. I do believe we've had confirmation with quite a few, but there are a lot where we've had
That
no
it was
testing.
a COVID death. Okay,
Yeah.
and there's so what is the confirmation of a COVID death? What is the official confirmation of a COVID death? That's
Right.
I think that's what would be interesting to know.
I think that's an interesting. Now you said you know a lot about hospitals. Are you
Yeah.
a doctor?
No.
Okay. You work in a hospital or with hospitals?
No.
Oh no,
Oh.
you don't work with the evil health insurance or big pharma. Okay, good. All right.
I invent complex medical devices for doctors and
Oh,
hospitals.
well, there you go.
I'm an inventor.
Thank you for doing that here
Oh,
in the United
no.
States.
I'm an inventor. I start companies and employ people.
In Canada, I was originally raised in Canada. Do you know what we call you?
Evil.
Figments of our imagination.
Bad.
Yeah, they don't exist anymore.
Good one.
No, because there's.
I'm evil.
I do not believe so. I think that's what
I'm
makes
evil.
America great and why we have more medical innovations than anywhere in the world.
Ask anybody on either coast. I'm evil.
No.
I start companies. I employ people. I pay them a lot of money, and I'm evil.
You should be ashamed of yourself.
I know I should be, but I'm not.
How dare you, sir? No, I think, what is the standard, for example, that we use in determining a flu death?
I don't know.
Okay.
That's a good question.
Yeah.
I don't know, because that could also be misconstrued by a lot.
But we do have a standard. And we do have a season, right? Now, flu, if you look at a flu season, it typically goes from fall to spring.
Right.
And then it resets. That's how you determine.
October to the end of March, and it resets.
Right. Some years they'll go to April if it's still severe, depending on the curve.
It depends where you live.
Why right now is the ticker, when you watch CNN, still going with the same season, even though we're coming up in July soon? Is that comparable to the flu?
Well, not yes.
Wait,
and
what
no,
is he asking?
Because at least in my ignorance, they're saying that weather is not really an issue with this COVID virus. I have no idea whether that's true or not, because we told a lot of other things that they backpedaled on.
Right.
60 days after they told us something.
Yeah.
So I have no idea whether that's true or not, but if you believe that it is not weather related, then there surely shouldn't be a cutoff on it.
Isn't that interesting? I think kind of what we're talking about.
But I don't know, because again, nothing. We've had so many contradictory things told us,
Right.
that it's hard to know what's real. So
Right.
would you like to know what's something that is real?
You and me having this conversation.
Yeah, we'd like to know something that is real.
About Israel?
That is real.
Oh, I thought you said about Israel. I was like,
No,
oh, no, are you going to come
that
up with
is real.
Yes.
So, what percentage of ventilator patients live? What percentage of
It's
patients
not a
are
good
going to ventilator?
prognosis. It's not a good prognosis. As a matter of fact, I was
do you
reading a
think
study.
it
I don't
is?
know the exact percentage because this morning I was reading that Some studies have shown people do more poorly on ventilators with COVID than CPAPs. And then I read a conflicting study. So I would actually be interested if you have a tiebreaker there.
So worthless piece of information. I was watching some show, and they actually had someone on who was quasi-intelligent. He was the CEO of Norwest Health, which is the largest healthcare system in New York.
Right.
Queens, Long Island. Hospitals like Long Island Jewish are all members of that chain. And he said off the cuff, oh, by the way, I'm not sure why everybody is
like 15%.
so worked up about how many ventilators we have. Like, okay, this is back when we had to have 2 billion ventilators, right?
Right. Well,
For every city.
40,000.
For every city.
And
right.
that's a good example of where it was politicized. They said, look, Donald Trump is not sending the ventilators. They topped out at needing about 4,000, and they had more than enough in the Federal
That's
Reserve.
my point.
Yeah.
So, but he said, everybody knows that only 15% of the people put on a ventilator live.
Right.
And the news program I'm watching didn't even listen. They went right over it. I'm like, wait a second, 1 out of every 8 people on a ventilator live? That means 7 out of 8 die.
Right.
Okay. So, I thought it was an interesting factoid.
Well, he thinks it's interesting. He's not thinking about it. One of the worst things that we can do for cancer in the United States, honestly, is radiation therapy and chemotherapy, because a lot of people that take radiation therapy or chemotherapy end up dying from cancer. Therefore, radiation and chemotherapy is bad, right? Like, that's essentially what you're saying. It's a nonsense argument. Of course, people on ventilators tend to die. Like, technically, if you want to avoid dying, just don't go to the hospital. Tons of people that go to hospitals die. Like, hospitals must be horrible. I bet if you compare the death rate inside of a hospital to, like, a fucking prison, the death rate in the hospital is probably higher. But, yeah, of course. That's because people that go to hospitals are fucking sick. People that are on ventilators literally don't have the fucking strength left in their diaphragm to fucking breathe. Like, these people are on the death's door in terms of, like, horrible dealing with the disease. So, yeah, of course, the survival rate on ventilators is very fucking low. But, like, that isn't the argument. The argument is that ventilators aren't some godlike equipment that were made out there to save COVID patients. Well, no, but it's like a last line of like shit that you can have to help somebody. Otherwise, you just fucking die. Like, having a 15% chance of survival, probably a lot better than having like a 0% chance of survival. Maybe. That's just me.
From one healthcare system that's
Right.
very large that had a shitload of COVID in it,
Right.
which was Long Island, Queens, and Manhattan. And that's where their hospitals are, right?
Right.
So I call a friend of mine. A friend of mine is one of the department heads at the Brigham and Women's Hospital in Boston.
Okay.
Brigham and Women's Hospital is a world-class Harvard Medical School hospital, and it was totally transformed in 1 week from a all-purpose hospital to the COVID-only hospital in Boston.
Mm-hmm.
So they transformed it from all functions for every specialty to COVID-only, a giant emergency room, and they went from 50 to 500 ICU beds in a week. It's impressive.
That is impressive.
Okay? And so I called him and I said, and I talked to him about a whole bunch of stuff, and I'll leave his name unsaid. And I said, so I heard that 15% of the patients that go on a ventilator live. Is that true in your hospital? And he says, no, in my hospital, that's optimistic.
Well, here's my question too. When
That's
I look at those,
optimistic.
I know
he says it's more like high single digits. So I'm saying you're telling me it's 1 in 10?
Yeah. So the studies
that's
that I
like,
had
wow.
read was
It's like,
9.
wow.
I'd read 9%, and then
that's
I'd read as
real
high
low.
as 32%. I don't know which one is true.
That
but
live?
Yeah, and it
Yeah.
seemed high to me because most of the studies seem to be between 9 and 20%.
Seemed high to me because it didn't quite fit my agenda.
Well, a lot
and I do
depends
wonder,
on what your population looks like, your patient population, where they come from.
Yeah, and as much as I know that might help the case that I believe deaths are overinflated, I think that regardless of whether it's COVID, by the time someone goes on a ventilator, they're
Right, hold on.
Shut the fuck up, Movement, all right? It's a stupid fucking meme.
Mortality of mechanically ventilated COVID-19 patients is lower than previously reported, reveals study in Critical Care Medicine. An online first study published in Critical Care Medicine indicates the actual mortality rate of adults with critical illness from COVID-19 is less than what was previously reported. Compared to earlier reports of a 50% mortality rate, this study finds that the mortality rate of critically ill patients who required mechanical ventilation was only 35.7%. Around 60% of observed of patients observed in the study survived hospital discharge. This study observes patients 18 years and older from 6 COVID-19 designated intensive care units in 3 hospitals in Atlanta, Georgia. The author notes that several considerations may have influenced the outcomes of the study, including that all critically ill patients with COVID-19 in the hospital network were admitted to pre-existing ICUs that had adequate staffing ratios and equipment. An accompanying online first editorial examines the role of mainstream, blah, blah, blah. Wait, so this is saying that over 60% of people survived on... It'll be interesting to see what these numbers come out of, I guess. That would be a really big deal, too. I would wait for the dust to settle on a lot of these, though, because holy shit. So, because this would say that ventilators work for over 60% of patients then. When I say work, I mean help survive.
Often at death's door. So a good example is my wife she came out of an operation, she had GBS, and what that does is it moves from the feet upward where she just couldn't move, she couldn't walk, she couldn't move her toes. And so the concern was it can actually move up to the diaphragm where it causes the same kind of neurological paralysis where they can't breathe and they're put on a ventilator.
Right.
Now I don't know that that's because ventilator treatment isn't effective, or at that point the GBS is so severe that it's not really enough to save them.
Right.
But I do think you're right in that the media, of course, politicized that issue and said, well, where are the ventilators? We need ventilators. And there were a lot of medical professionals saying that's actually not the best way to try and help these people, particularly when we should be talking about CPAPs, the difference between a pressurized environment or assistive.
I don't understand what he's saying. So CPAPs, I think are used as a level before, because CPAPs, somebody correct me if I'm wrong, where are my medical people in chat? I think all a CPAP does is it pushes air in and out of your lungs. I think that's all it does, right? A CPAP is like a pretty basic machine. Whereas I think ventilators are more refined so that they don't cause damage. There's a name for this. But the problem is that it's complicated to explain, but the way that your lungs work is basically a diaphragm comes down, it creates a lower pressure environment inside your chest, and then air comes in. The diaphragm doesn't just push against your lungs to bring things out or rip anything out. And to constantly push and push and push air into somebody's body is a pretty traumatic, it causes trauma to the lungs. It's not good for you. So ventilators are supposed to pretty carefully monitor the pressure inside and outside of the body to make sure that it's in the most easiest way possible. And then even ventilators, I don't think 100% avoid trauma to the lungs. It's a traumatic process to put somebody on a ventilator. A CPAP, I don't think is capable. I think you can buy, unless hospitals use different ones, you can buy CPAP machines in your house and use those. It's just kind of it's a very basic, pushes air in and out of the body. Kind of traumatic, but not as aggressive as a ventilator would be.
Right, because the real question is how much oxygen.
Because I think on a CPAP generally, I think the general use cases for a CPAP is just it just wants to keep the airway unobstructed, so it just has to push a little bit to keep that open. It's not actually helping you fucking breathe. The CPAP is unobstructing your airway so that you can breathe. Ventilators are for people that can no longer breathe by the power of their own diaphragm.
They get.
Right.
And there's other ways to supply oxygen without intubating someone.
Right.
And so the other ways to do that actually could be more effective, but it's hard to know because you don't do a study and et cetera, et cetera, et cetera. Everybody's trying to.
You're talking about hyperbaric chambers or something?
Well, either a hyperbaric chamber or even the oxygen helmets that if you looked at the hospitals in Milan and the hospitals in Italy, because they didn't have thousands of ventilators.
Yeah.
They used these oxygen helmets, and basically you're increasing the level of oxygen for somebody, but you're not forcing it into their system and intubating them.
Right.
So
the problem is that if somebody requires ventilation, they can no longer breathe under their own diaphragm. These are severe cases of pneumonia where you don't have your diaphragm just doesn't have it in it anymore to actually lower the pressure inside of your lungs and bring air in. Just putting you in a chamber doesn't change that. It's not how it works.
You can make an argument that perhaps that could be as effective or maybe more effective.
It probably is more effective,
but
there are some trade-offs. Have you ever seen oxygen helmet hair? terrible.
Don't care.
Makes
So one of the most frustrating fucking things. Oh my God, there was a doctor that pointed this out really well in a Twitter thread a while ago, and it had to do with some dumbass shit Elon Musk was saying. One of the most frustrating fucking things in the world is when a layman comes in and they're like, and they present to you this incredibly obvious fucking problem with something you're doing, and then like, well, why don't you just change that, bro? And it's like, wow, dude, nobody. All the years that you go to med school, all the research, and no one ever thought, wow, man, maybe ventilators are actually pretty harsh on a human body. Man, maybe we should do something different. Nobody thought of that until you came in. And it's literally Twitch chat backseat gaming, like medical professionals. It's literally what it is at that level. Nobody thought of this. Like, you're right. Oh my God. Like, nobody thought of different, like, maybe different pressured environments. It's not like we had giant fucking machines that we stuffed people's entire body into during was it polio? Like, like iron lungs or whatever. It's not like that ever existed. Like, literally, this information was lost to the medical arts until you hopped on Twitter and your untrained ass, came out and gave these nuclear level fucking takes that just you saved the whole medical community. Elon Musk does this shit all the fucking time.
hat hair look like child's play.
I don't care about hair.
I
obviously don't care about hair.
I would like to go back to what you mentioned about the summer, how they are continuing these death counts, saying, well, weather doesn't affect it. That's a very generalized statement. Kind of like these are the deaths, right? That's a very generalized statement, whereas when you get a little granular, it tells a little bit more of a story.
I saw a video from a New York City doctor who proposed the pressure from the ventilators was actually causing a problem. COVID patients might not have lost that strength in their lungs, even though the symptoms pointed to that. I would be curious to see that, I guess. My understanding is this isn't anything special. It's just pneumonia. Like, that's what this is. It's pneumonia. I would have to read exactly what it is, but basically, like, little pustules inside of your lungs fill with water, and it inhibits the ability for you to breathe. Your breathing becomes more and more labored, and eventually your diaphragm loses the energy to continue carrying on breathing. Is there a name for this? Acute respiratory distress syndrome, maybe as well. What's the difference between ARDS and pneumonia? But, like, it's not like this is anything new. It's not like COVID-19 is, like, giving us, like, new forms of ARDS or new forms of pneumonia. Like, these are all things that are, like... Here's a doctor talking about ventilators and stuff.
It's funny how Gwyneth Paltrow rarely suggests how to hit a cross-court topspin backhand. Elon Musk doesn't tend to tweet about giving pathos.
This is exactly the video I was talking about, actually. It wasn't a Twitter thread. It was this guy talking in a video. We can 7-minute this one real quick. Sorry.
To a portrayal of Richard III, and I'm pretty sure Novak Djokovic hasn't espoused his views about payload distribution for a geosynchronous satellite launch, but yet they all seem to understand medicine well enough to inform millions of people. Now, I would single out Novak there as having the worst comprehension of science out of the three, as he's an anti-vaxxer, not to mention his strange dietary neuroses, but although it might sound bizarre, there is now an anti-venter movement, who are sadly not people opposed to that slit at the back of a suit. They are people who are against the use of ventilators in the treatment of COVID-19. This video is about 3 examples of the same erroneous thought process and, in my opinion, the biggest challenge facing science in 2020. If you're like me, you know more about managing critically ill patients than doctors and scientists who've dedicated their entire careers to it. And so you should drink Dunning-Kruger. It's the only choice for the self-educated gentleman. Dunning-Kruger. It'll give you confidence. Although I don't think you need any help with that. Cheers. I recently popped up in a Real Engineering video, which made my year because I love that channel. The video was about ventilators. We've all heard how they're an essential bit of kit in the fight against COVID-19 and how thousands more are needed. And this led to an outpouring of well-intentioned engineers trying to design ventilators, but most of them were next to useless because they're just too basic. Modern ventilators allow the patient to control breathing, whereas these kind of mindless pump jack bag squeezers deliver mandatory breaths at a set rate, which I'm sure you can imagine is a very unpleasant experience unless you're deeply sedated and paralyzed, which we don't like doing in intensive care, except maybe in the first few hours or day after intubation. After that, we try to keep patients lightly sedated, so they're not aware of what's going on around them, but they're breathing for themselves. And they have far fewer complications that way. When they're getting better, we try to wean them off the ventilator, which can take a long time, and that's where all those advanced settings and modes of proper ventilators come in useful. Crash intubation and ventilation of COVID patients is not why we need many ventilators, it's their ongoing support and that weaning process. Here in the UK, the government rather botched the whole ventilator thing quite royally. Instead of doing what industry leaders had suggested to the government, which was to repurpose factories to make ventilators using existing plans from ventilator manufacturers under license, the UK government took a different approach. Boris Johnson hosted a call with 60 captains of industry from the UK, household names like JCB, Rolls-Royce, Airbus, Honda, and the focus was on making something from scratch, from the bottom up. As has so often been the case with this virus, military metaphors were drawn. It would be a crowning moment in British manufacturing, akin to the Spitfire during the Second World War. Medical advisors said, okay, but we don't need those basic bag-in-a-bottle pump jack.
It's a stupid fucking meme.
Iron Man, by
machines,
the way,
we need the
vegan,
product
by
to be
the
fit
way.
for purpose. But it soon became apparent that what was being proposed was woefully under-equipped to meet what was needed. Instead of listening to experts, British politicians had felt that they understood the problem better and tasked people with a proven track record in an entirely unrelated field the job of solving the problem.
Ventilators are big machines that are very complex, that are very expensive. You need you need a group of people that really know what they're doing. We took auto lines, we took a lot of different people.
I don't believe you need 40,000 or 30,000 ventilators. You know, you go to major hospitals sometimes, they'll have 2 ventilators, and now all of a sudden they're saying, can we order 30,000 ventilators?
But this is a very unforeseen thing. Nobody ever thought of these numbers. Nobody ever saw numbers like this. We are now the king of ventilators all over the world. Ventilators, 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 ventilators.
Ventilate.
Now, I'm really not interested in getting bogged down into an analysis of Donald Trump's actions on ventilators, but I think it's clear that the so-called king of ventilators has also elected not to listen to those with experience and knowledge in the field and instead decided upon his own course of action. I do wish to stay in America for my next example, which brings us to the great Elon Musk. And I don't mean great sarcastically there. I do think he is an immensely impressive character, but that doesn't make him immune to criticism. People warn me that if I do criticize him, his pucks will come after me, but I consider myself a big fan of Elon myself. Regular viewers will know how obsessed I am with space. I share his love of memes, clean energy, electric cars. He's much more interesting than other billionaires. I just wish he'd developed some insight into the limits of his own knowledge. You probably think I'm going to hate on him for promising ventilators and delivering CPAP machines, but I'm not. That's not what this video is about. I will, however, translate that sentence because I think it is relevant to my main point. When medics say ventilator, we mean a machine that delivers ventilation to an intubated patient, someone with a breathing tube down into their lungs. Being intubated and ventilated isn't very nice, and it can come with all sorts of complications, so we try to avoid it whenever we can. In the last 20 years or so, we have used non-invasive ventilation to do just that. We've managed to prevent millions of people being put on ventilators and also helped many who would not have been suitable for ventilators. Sometimes these non-invasive masks that fit tightly across the face are referred to as CPAP or BiPAP machines. Technically, they are a type of ventilator, although it's not what people normally understand when you say ventilator. So when Elon delivered CPAP machines instead of invasive ventilators, some people were a bit salty about that. Whatever, I don't really care. CPAP machines can be converted into invasive ventilators, basic ones, and they have been in New York. So as far as I'm concerned, well done, Elon. I'd also like to say well done to Tesla engineers whose design for a ventilator was very impressive, and they definitely don't fall into that category of just a mindless bag-squeezing machine. So it was very cool to see all those car parts being used for a medical device. Good job, engineers, as well. But this criticism of Elon, which I don't think was entirely fair, clearly bothered him, and it's led to a response where he's now defensively spouting theories about mechanical ventilation on Twitter after condensing medical school and critical care training into, I guess, about a fortnight, which simply betray a complete lack of understanding about what doctors actually do. First, suggesting we have not evolved to have tubes down our throat. Well, thanks, Elon, that's quite the newsflash. My personal choice would be a mask, meaning CPAP, at moderate pressure with O2 of 50%, as if this is something that we have not thought of. Now, I'm not making this up, I promise you. Last week, I looked after a middle-aged man with severe COVID lung disease, and he was doing well on CPAP with a PEEP of 6 to 8 centimeters of water and an FiO2 of 0.5, i.e. oxygen of 50%. This is not a strategy we're unfamiliar with, but after 3 days, he crashed and had to be intubated. If he had not been, he would have died. Here, Elon feels that ICUs are jumping the gun and setting PEEP and O2 too high. I don't even know where to start with this one. The very core principle of ventilating a patient is to reduce oxygen and pressure being delivered as much as possible. ITU nurses are experts at doing exactly this, and it's been an absolute fundamental of management for decades. This is the equivalent of me saying, hey, you know, when blasting a radio machine into an Earth cycle, jettisoning 90% of the launching missile seems very wasteful. Maybe you could consider reusing some parts of it? Just my opinion. Then I wouldn't go much above their natural lung pressure. I really don't understand this because lungs work using negative thoracic pressure, so it's literally impossible to ventilate anyone without going above their intrinsic lung pressure. Depending on the specific pedestrian strength, impact with a self-driving car could result in their internal pressure dynamics being fatally exceeded. I would suggest a pedestrian avoiding mechanism. A camera should suffice, just my opinion. There are other things I'm not too fond of as well, like his promotion of hydroxychloroquine and remdesivir, which may work, but so far, and I want to say this clearly, have no evidence to support their widespread use. More research? Yes, please. But so far, nothing even near concrete, and saying looks promising to 33 million followers has implications that he should be aware of in view of his previous tweets that have been taken in the wrong way. But I want to give Elon the benefit of the doubt because I do believe he wants to help, and that brings me to the anti-ventilator movement that I mentioned at the top of the video. A highly intelligent scientific mind like Elon's and conspiracy theorists seem to be referencing the same things. How can this be? Many people online now claim that ventilators are killing people. There have been breathless articles in the news stating that 80% of patients placed on ventilators die. Now, one interpretation is that ventilators are killing people. Another, more logical interpretation is that the people being placed on ventilators are so sick that even a ventilator cannot save them. What if I told you that 80% of people who die in motorway crashes were wearing seatbelts? Would you conclude that seatbelts are killing them, or were they just traveling so fast that even the seatbelt didn't save them? Another statistic that's important to know here is how many people not wearing seatbelts, i.e. people who weren't intubated at the same disease severity, go on to die. If 100% of them die, then your intervention has actually saved 20%, which is still very unsatisfactory, but it's a long way from saying ventilators are killing patients. And finally, we come to what I think is the biggest problem facing science today, the role of uncertainty. In science, it's correct to continually update your theories about how things work based on new evidence. Science is not a set of facts. Science is a method by which we try to work out facts. But when science course corrects in the public eye, instead of being lauded as improving our models, the public and media seize on it by saying, doctors don't know what they're doing, doctors are killing people. COVID-19 is a new disease, one we've never seen before. When it first hit our shores, we thought it would behave in the same way that other pneumonias that cause an acute respiratory distress syndrome or ARDS do. These patients have stiff lungs and require high pressure, and we were told to intubate early. Many patients did behave just like this, but many did not. And the amazing thing about the internet and social media is we started talking about these experiences. Elon Musk might think that ITUs are blindly setting everybody to high pressures and oxygen settings, but being a Zen intensivist is about making tiny adjustments, watching, waiting, adjusting again, being aggressive in your conservatism, doing your utmost to do as little as you can to the patient. The idea that Elon has of doctors turning the ventilator up to 11 and just walking off is nonsense. Another major factor was that CPAP was felt to be a very effective way of aerosolizing SARS-CoV-2 into the atmosphere and infecting everybody. So with shortages of PPE, this also affected decision-making. Italian groups dealing with some of the worst cases were using helmet interfaces, which also has other benefits. This is footage that I showed before of my friend's hospital in Bergamo, which I pronounced wrong last time, apologies. Indeed, the Italians have led the way in this, and they've been publishing their thoughts about maybe this disease isn't what we thought. A world-renowned master of mechanical ventilation, Luciano Gattinoni, the guy who literally invented proning patients, turning them on their front, wrote on March the 30th that this is not a typical ARDS. My buddy here was WhatsApping me at the same time saying that this isn't typical. In ITUs all over the world, people had already realized that some patients don't need those high pressures and were changing their guidelines. We all know that this is an incredibly diverse disease in the way it presents. If you take 3 identical 40-year-olds, one will have a mild illness, one will end up in ITU, and another won't even know they've had it. So why are we surprised that all patients are not behaving the exact same way on a ventilator? A few days later, a New York doctor called Cameron Kyle Siddell took to the internet to say the same thing. As a YouTube doctor, I can hardly criticize that. The content was all very sensible. When a friend sent it to me to fact check soon after it went up, you can pause and read my response here if you're interested, it all seemed fine, but for reasons I think were out of his control, he became hailed as an iconoclastic whistleblower, daring to stand up in the face of medical hegemony, a lone voice in a sea of clueless doctors, which has played directly into the conspiracy theorists' hands. Instead of his views being part of a healthy, normal discussion about the changing understanding of a new disease, they've used it as evidence that doctors don't know what they're doing and that no COVID patient should be intubated, which I don't think Dr. Carl Siddell has ever suggested. And that the demands for ventilators are part of some fake news plot to discredit Trump or siphon money off to do something, I don't know, I can't keep track of all their crazy theories. Brilliant people are not brilliant at everything. If you think Elon Musk's views on ventilation are valid, then I assume you think Mark Zuckerberg's attitude towards privacy and Jeff Bezos' thoughts about workers' rights are equally important. Just because he's a cooler billionaire than them, it doesn't mean we should treat him any differently. This is a scary, previously unseen disease. People want a life ring when adrift in a sea of uncertainty, whether that's hydroxychloroquine, ventilators, or believing the whole thing is a hoax. The reality is that many questions about COVID-19 right now don't have an answer. We're trying to figure it out. We're going to get some things wrong. It's imperative that we're cautious and we don't get sidetracked with half-baked ideas, because unlike in Silicon Valley, where mistakes can cause investors to lose money, in medicine, lives are at stake. It's funny how Gwyneth Paltrow rarely...
Okay, quick thing on ventilators. Sorry.
Well, let's go to some specifics there, because I've heard that as well. Does UV light kill COVID? Yes, beyond any shadow of a doubt, it does.
Good.
Where does COVID have
That's
a
good.
more difficult time living?
Outside.
Heat, humidity. Specifically, once you get above 80 degrees, I think depending on the study, above 80% humidity, some have said as low as 72, UV sunlight, it can kill it, eviscerate it in 60 seconds.
Great.
Now, some people
Let's
can
move
say...
to Houston.
Yeah, exactly. Yeah, but then you have to be in Houston. Again, we're talking about trade-offs. Final thing then, I think we found quite a bit of comment. I'm glad you sat down.
No, because I just thought it was an interesting question. I hadn't really thought about it.
FYI1,
The issue is when you have people whose
COVID-19, unlike the
livelihoods have been
flu,
shut
is
down based on a number that is
hypercoagulability. It can actually cause blood clots, strokes, heart attacks, etc., so it is perfectly reasonable to count those as COVID deaths.
Cool.
at the very least unverifiable, and I would argue verifiably false. Let's go to a specific. Do you think, for example, and I know that you probably agree with me on this, but some people have not. If I try to kill myself, okay, let's say I put a shotgun in my head, I take a bottle of pills, I don't know, I stab myself. Some people have done it. It's rare, not the easiest way to go. And I'm close to killing myself, but not entirely successful. And I go to the hospital. And then at that point, obviously they have me, let's say, in a ventilator. They're trying to keep me alive. I happen to contract coronavirus, COVID, right before I die. Do you believe that should be listed as a COVID death?
No.
It is. That's
Wait.
an exact case in Michigan.
Well, it shouldn't be.
And there are thousands of...
Wait, hold on. That sounds like yes. That's what would kill you. If you try to commit suicide and you fail to do so, and then you go to the hospital and you contract COVID-19 and then you die, that's a COVID-19 death. No? Am I missing something? Crowder?
Cases like that.
Yeah, that shouldn't be.
Yeah.
Because that's not the case. Because,
Right.
because COVID isn't what killed somebody. It was some other underlying condition that killed somebody, or some combination of underlying conditions.
That's true of everything.
Or circumstances that killed somebody.
And if you take away those numbers, for example, the 25% that are completely untested, the kind of cases that he's presented to you, which are verifiable, and then, of course, you take away the abysmal New York policy that forced nursing homes to take in COVID patients from hospitals, you were talking about many, many tens of thousands of lives that aren't on that list. Now you're looking at a severe flu season.
Yeah.
Do you think that it would change the public's perception of the very stringent lockdowns if they understood the real numbers?
Sure it could. You know, and that's why statistics are important. So
this is a severe flu season in conjunction with, I'm pretty sure we're still having like normal influenza deaths, and this is after we've already gone through draconian levels of lockdowns. Like, these guys are trying to act like it's fucking, like it's fucking Call of Duty, where whoever does the most damage is who gets credit for like the kill. Like,
so, you know, in my statistics class a long time ago in university, I remember one thing.
What'd you learn? Liars.
My professor told me
statistics don't lie, but liars use statistics, or some shit. Or there's lies, there's damned lies, and then there's statistics or something. It's gonna be one of those two quotes. It's what people always bring up when they don't understand stats.
Just remember this one thing, and you'll pass statistics.
I think I know what you're about to say.
Statistics don't lie, liars use statistics.
It's always one of those two quotes. It's
you gotta
always.
be really careful when you listen to statistics from people to make sure you really know what they're measuring.
Yeah, I think you're absolutely right.
And that's what basically you're saying, and that makes sense. What you're saying makes sense.
I appreciate you sitting down. Dries?
Yeah.
Unique name. I appreciate it. Thank you very much, brother.
Yeah,
You've been really
What's your
helpful.
name?
Steven. Steven, sorry, how rude of me. I didn't give you my name.
That's
I was overeating.
That's all right. It's nice to meet you. No,
Nice meeting you, sir.
I enjoy debate.
Yeah. Well, it doesn't seem like we were really debating about a whole lot.
Just most people, all right? It's a stupid fucking meme.
Stephen Coward.
Right.
They get all goofy, and people are afraid to think, and people are afraid to speak their mind.
Well, that's what the change my mind is.
Which is a shame.
It is a shame. It's a shame, and what we just did, this is what we've done for years. And we have been chased out of campus, shouted down. I've been referred to as a neo-Nazi. Your guess is as good as mine. My Jewish friend also referred to as a neo-Nazi. So this idea now, it really is about shouting people down. I mean, now you have people who want to propose policies to make it illegal for folks who don't kneel. I mean, how do you have a discussion with that at that point?
People
I'm
don't
more than willing to
kneel?
sit down and talk with anyone with whom I disagree. Seems to me like you're probably like me, where you like to rationalize discussions even if you agree, but that's how you flex the muscle.
Right.
You know, that's how it's a perishable skill like anything else. If you don't use this rationalization portion of your
Wait, what is he
brain-
talking about?
And they don't teach the Socratic method in college anymore.
Yeah,
I've asked every college student, said, are you familiar with the Socratic method? That was philosophy 101. That was critical, but now they teach critical race theory, critical gender theory.
The Socratic method has nothing to do with philosophy 101. I could be wrong, but I don't even know if the Socratic method is like part of like anything to do with. I'm sorry, it's not. I actually never took a formal philosophy class. Do you learn the Socratic method when you're like learning like your intro to logic, or like your basic logic classes in philosophy? Do you learn the Socratic method? It isn't the idea behind the Socratic method is just a way of questioning a student. I don't think it has anything to do with like logic, right? Like learning like if P then Q. Like these are the types of like logics that you'll learn. If you take a philosophy class, it's not like the Socratic method. It's not like who's got an ethics book? Control F. See if there's.
Which is fine as an addendum.
I had to take 2 years of philosophy in undergrad, so
Okay,
it
so
was
you.
forced. It was forced.
Yeah.
And it was good. It was good. I'm glad I got it. But anyway, you're asking a good question. And,
Shut the fuck up,
basically,
Billy, all right?
you
It's a
can't
stupid
argue with the
fucking
fact
meme.
that if every case, or almost every case, where COVID is involved is considered a COVID death,
Yeah.
it has to be overstated. It's
Right.
impossible that it's not.
Yeah.
The question is how much is it's overstated?
Right.
And you would seem like there should be a couple of different counts.
Right.
One count would be anybody who had COVID who died.
Right.
Another count would be anybody who had COVID and was autopsied in
Right.
some way, shape, or fashion, or examined in some way, shape, to determine the cause of death.
Right.
Should be another number.
Yeah.
You know? And then anybody who's a question mark should probably be another number.
There should be a separate category.
There should be separate categories.
Right.
If
Yeah,
you
instead they're
think
all
about
lumped
it.
under.
And
Now,
that
the real
doesn't make
question
sense
is-
when you really stop and think about it, it doesn't make any sense.
No, and it's not the same standard that's applied to other, seasonal viruses like the flu.
I wonder if Steven Crowder was okay with the OAS's examination of the elections in, oh God, I want to say Venezuela. Not, hold on. Bolivia. Yeah, fuck. We were talking about Maduro and everything yesterday. I wonder if Steven Crowder accepts that statistical analysis that didn't look at, like, every single particular vote. I wonder what his tweets were about that shit.
Or frankly, the same standard that was applied to other coronaviruses that we've seen or other SARS viruses that we've seen. This is the one scenario where it's measured entirely differently.
But it's not. We've already demonstrated that, right? We can literally see on the CDC's website that they explicitly say that they don't go through every single death and they can't autopsy every single person that dies. Do you require somebody? Do you require? Actually, we can just look this up. I'm sorry. Do you need consent from family to autopsy? You request or may be asked to get permission for an autopsy to be performed after your loved one has died. You can request consent to an autopsy. When autopsy to be done, you must sign. Someone related to died and their death has been referred to a coroner. You won't be asked to give consent for a postmortem to take place. This is because the coroner is required by law to carry out a postmortem when a death is suspicious, sudden, or unnatural. Huh. I wonder if that includes disease.
And at the very least, there have been others that were just sort of lumped in when it was new, and then it was revised.
Well, I'm going to give you an example. An example of the same thing. It's going to sound stupid. It's personal. Is technically, I remember seeing my father's death report. Okay, when my father's death report was written, it said he died of a heart attack.
I think we wanted to talk after this.
But guess what? He did die of a heart attack. However, he had lung cancer for 4 years. Now, do you think the heart attack killed him, or do you think the cancer?
I thought you was going to say you jumped out behind his bed frame and went boo.
No. But my point is, cancer's the thing that killed him. And
Right.
It just so happened that at the very end, his heart gave in, and that's how they put it on the report.
Wait, but you just argued the exact opposite for 5 minutes. Right, you literally just argued the exact opposite. So it said a heart attack killed him, but I mean, he had fucking cancer for 4 years. So what actually killed him? That's a good question. Well, they said that COVID-19 killed him, but in actuality, he'd like shot himself and ended up in the hospital. And then he died. Well, like, wait, you're giving the opposite argument. I don't think you realize it or not, but.
Speaking of
Which
cancer.
is bullshit. Yeah, it's all right.
Okay, it's very different.
Don't worry about it. I love cigars.
Oh,
So anyway,
thank you, Dries.
Really nice
Appreciate
to meet
it, brother. What a swell guy, that Dries. Weird name, though. By the way, if you want these videos to continue, please do consider joining up at Mug Club. It's $69 annually for students, veterans, active military. You get this wonderful hand-etched mug and the full daily show, not available on YouTube, but available exclusively at loudwithcrowder.com/Mug Club, along with the entire Blaze TV lineup. If not, at least bookmark this channel and check back every single day for new videos and content. Let's get back to the show. Meet Paul. Nice to meet you, Paul.
Nice to meet you too.
So, I understand that you wanted to sit down. First, kind of let me explain what Change My Mind is and what isn't.
Sure.
It's not really meant to be a debate. It's meant to be rationalizing one's own position, particularly in subjects that are controversial at the time. Often those subjects are the ones that are really the hardest for people to sit down and have a conversation about and find common ground and or disagreement, right? It usually turns into something like a yelling match. So today, it's back in the news, kind of went away for a while. I absolutely do believe that the COVID-19 death count is inflated. I agree with a lot of experts who say that's the case. I think it's pretty hard to argue for the 110 to 100.
So we've spent 24 minutes of this 39-minute video of a Change My Mind video. We've spent 24 of the 39 minutes, over half the video, talking to a guy that basically wholesale agreed with Crowder, just as an FYI. If you want to know how bad his conversations must have been when he was on the ground, because holy shit, that's a lot of wasted time.
20,000 number total that's being cited out there. If you disagree with me, you're more than welcome to change my mind.
Okay, so what numbers do you think it actually is?
Yeah, well, first off, let me ask you, do you agree with that number, that general total that's been given out?
Yeah, more or less.
Yeah, I think it's at least 25% inflated.
Okay.
And the reason for that is for the same reason that, Dr. Birx has expressed that she believes it's about inflated by at least 25%. And a lot of healthcare professionals have. Let's go through a couple of instances. So in New York, 25% of all COVID-listed deaths were never tested at all.
Right.
Did you know that?
Yep.
They were never tested, just listed as guessed COVID-19. Then are you aware of what happened in Colorado? And by the way, none of these are trick questions. A lot of people aren't necessarily aware of these. Are you aware what happened in Colorado?
Not offhand. Go ahead.
So they said that they needed better data. And listen, let's both agree that data could change tomorrow. So something that we could say today could be wrong tomorrow, both of us, right? Especially when it's a pandemic and it's a new mutating disease. In Colorado, they said we need more accurate data because this is much like New York. Everyone who dies who has COVID in their system just lists as a COVID death. That doesn't really help us get a good picture of what's going on.
Right.
So they separated death from COVID. They separated that from death with COVID, where people who happen to die with it in their system.
Right.
The number of deaths dropped by, take a guess.
25%?
About 25%. Then all nursing home deaths were listed as COVID-19
I still
deaths,
haven't been able to find a source
despite
for
the
that.
fact that 25% of all deaths in any given month come from nursing home patients because they're very old.
Right.
And again, that removes 25%.
And it is true that a lot of people that have been dying from corona are your older patients. People
Absolutely.
that have pre-existing conditions,
Yes.
all sorts of other things.
Yeah. In
But
New York,
with a lot
actually, the
of these
median
cases-
age for a corona patient death is older than life expectancy.
Makes sense.
Yeah.
So I think with a lot of these, even though it's a case with corona, I think it could just be the one thing that tips them over the edge.
Mm-hmm.
Sure, they had diabetes or whatever, some long chronic thing, but I think it was causing people that were going to die anyway to actually die ahead of time, unfortunately.
I think in some
Good.
cases that's true.
Okay. We're on the right
not
track.
in all cases. So let's use an example. If someone's hit by a car, George Floyd had COVID in his system.
Right.
Do you think COVID killed him?
Nope.
No, I think
That
we
is
would
the
both.
2020 headline of the year, though, right?
Right, yeah.
Corona and George Floyd.
Right. That's exactly right. And then back to Corona once the riots started settling down.
I think he linked the source.
No.
Yeah, we looked at the source, but the source didn't say that at all.
Exactly. I think we would both agree that that's probably the knee on the back of his neck, and obviously the drugs in his system would be what led to his death, not the fact that he had COVID, where seemed from what we know now, asymptomatic.
The drugs in his system absolutely did not lead to his death, by the way.
We would say that's not a COVID death. Now, in the state of New York, that would have been listed as a COVID death only a few weeks before if you remove the politicization. Someone hit by a car who has COVID in their system, is it a COVID death?
I've heard cases of that. Have they actually filed them as COVID deaths?
Yeah. Let me give you a very specific, let me use another hypothetical, because I think this matters when you look at these numbers. Let's say I try and kill myself. Bunch of pills, put a gun to my head, whatever it is. Take a very effective method of attempting suicide. I'm close, but no cigar. So I get put in the hospital, right? And basically put on life support. They're trying to help me survive. And I don't make it, and just before I die from my suicide, I get COVID-19. Is that a COVID death?
No.
It
And
could
I would
be.
think it would be one of these few outliers, too. Does that add
That
up
is
to
literally a
25%?
COVID death right now.
But would that add up to 25%?
Well, it's tough to know because 25% of the deaths are never tested. So here's what we do know. 25% of the deaths are never tested. Anywhere we've said, let's separate death from, let's separate that from death with COVID, we remove 25% off the bat. Anytime we look at a lot of these individual cases where we see these people who died with COVID, there are a lot of...
Can somebody explain, or can somebody link, maybe he linked in here, this removing deaths from COVID from deaths with? Does he, I imagine he's been linking something or whatever. Does anybody have a link to that 25% thing? Is that like an actual analysis done, like as part of some study, or does that come from some bullshit website, like the Daily Pundit or some shit? Destiny here. Okay, thank you. Wait. Destiny, they explain it here. Okay, hold on. Colorado changes data amid complaints of deflated COVID-19 deaths. Nearly a quarter of listed fatalities don't have COVID-19 in their death certificate. A quarter of listed fatalities don't have... Okay, the journal. Until Friday, nearly a quarter of the people reported as coronavirus deaths in state statistics didn't have the virus listed on their death certificates. People reported at the State Department on Friday, adding uncertainty how many people the virus had killed. The number of coronavirus deaths in state figures topped 1,000 earlier last week, and the number stood at 1,150 with officials. Colorado Department of Health and Environment revealed during a call with reporters the number does not represent the number of people who died due to COVID-19, the disease caused by the coronavirus. Instead, the death figures CDPHE have been providing for weeks is more accurately describes the number of people with COVID-19 who have died for any reason. The number of people who have died and have COVID-19 listed on their certificate is 24% lower, 878, according to CDPHE's latest figures. We recognize that there certainly has been confusion around this topic. But even the latest revelation does little to clarify the battle over the virus death toll, which has become one of the most relevant. State representative has called for a criminal investigation. The coroner joined the media call unexpectedly Friday to question state officials about the reported numbers. Politicians and activists across the country have engaged in heated debate about how the pandemic's toll has been inflated. What the people of Colorado want to know is not who died with COVID-19, but who died of COVID-19. So my guess then would be that lowering of 24% is probably somewhere between 0 and 24%, because there's probably people that died with it, not because of it, but it was certainly a contributing factor, but maybe not every single person. Also, so this is one state as well. I don't know if every single state is having these same problems, or it's literally just Colorado that's reported it in this way as well, because this sounds like a state level thing and not like read till the end. They explain why. Issue. There are two systems for reporting COVID-19 deaths, CDPHE said. The one with the higher numbers is an epidemiological surveillance system that tracks deaths of people diagnosed with the disease. The other records causes of death on death certificates by county coroners, doctors, or medical examiners. Dr. Eric France, CDPHE's chief medical officer, said the state's surveillance system reporting is in line with federal guidance and matches how other states are also reporting deaths, allowing for a quick apple-to-apple comparison across states. Death certificate data also gets reported to the federal government, but it can take weeks or months for those numbers to trickle in. Having uniform surveillance definitions across states is vital for tracking the spread of the virus and allocating resources, France said. Having that standard measure so that I can be confident that the way we're measuring it and the way it's being measured in Texas or Florida is the same really is important for the whole nation and how it manages this pandemic, he said. The conflict between the two systems boiled over this week after the Montezuma County Coroner's Office disputed the state's claim of a third fatal case of the coronavirus in Cortez, as reported Tuesday by the Journal. Also, State Representative Mark Baisley asked the 18th judicial judge to investigate whether CDPHE broke the law by classifying several deaths at a Centennial Senior Living Facility as coronavirus deaths, first reported by 9 News. Deaver said Tuesday the person tested positive for COVID-19, but an investigation by him and the pathologist determined the cause of death was ethanol toxicity. His blood alcohol content was 0.55. Jesus. Deaver said a BAC of 0.3 is considered lethal. COVID was not listed on the death certificate as cause of death. I disagree with the state for listing it as a COVID death, and we'll be discussing with them, told by the Journal. Both then accused CDH but CDH officials denied it, saying there was confusion about the reporting systems. Death certificates are not public records under Colorado law. We do not change death certificate. Wait, what is my time at in here? 7:21 p.m. Wait, hold on. Destiny can come on whenever he wants to, but tonight I just want to chill with the boys. Anyway, Destiny's either on drugs or autistic. That's fucked up shit. Don't say it. Oh. Oh, wait. So he didn't invite me because he has big guests on tonight. Nice. It's all good. Oh, wait. I can't fish during a blood moon because I'll get fucked up, right? Can I put like a wall between me and the fishing area so that I don't get like... Would this work? Or is this gonna fuck me hard? Why can't I... Oh wait, starfish. We already got it. Fuck you. We do not change death certificates and have not changed death certificates, said Chris Boyle. The answer didn't clearly set up as Davers. You guys record every COVID case that dies, whether that is a cause of death or not. He said, to my knowledge, you don't do that with influenza. Is that correct? Hurley said influenza is reported differently, but there are other diseases where the same dual system reporting occurs. Most of the time, cases do not line up very closely. There can be slight discrepancies, he said. Out of the confusion, Ball said he expects the numbers from the two reporting systems to converge over time. That's because death certificates can sometimes take weeks to complete. So it's possible some of the deaths in the gap between the two systems might not have a death certificate yet. Overall, France said far too many people are dying from COVID-19. That is important to remember, that every number has a name. Polis said that he would order the CDPHE to clarify its public death reporting, though he called the idea of criminal charges for state health officials inappropriate. Okay, so it sounds like what's happening, if I understand this, it sounds like what's happening is that it sounds like that any death that has COVID-19 related with it is initially reported federally as a COVID-19 death, and then as the death certificates come in, they slowly adjust those numbers, and then over time the numbers converge. That's what it sounds like is happening. That's what it reads like here. But okay.
A lot of complications. Texas, I don't know if you're a Texas native, if you're California yourself.
Yep.
The first Texas COVID death, do you know what it was? The first one registered as a COVID death.
Not offhand, actually.
And it's not a trick question, because I was surprised. How old do you think the guy was?
97 is what he's going to say?
I don't know, 60.
97 years old with a severe underlying condition. And I couldn't find the exact underlying condition because I don't necessarily have access to all the medical reports. I would think that one of the underlying conditions is being 97.
Yeah, that'll do it.
So when you look at the numbers and you say this reduces it by 25%, the average age of COVID patient death is older than life expectancy in states like New York. And for example, in New York, there was a policy where nursing homes had to take in, this COVID patients, which, listen, while the last gentleman was talking about compassion, that to me is just an absolute nightmare. It's a buzzsaw where you take nursing homes and force them to take in sick patients from the hospital that should be equipped to deal with them to a nursing home where they're not able to deal with them. We know that they're most at risk. If you take away just those, just the ones that aren't tested, just the litmus tests that are used like in Colorado, and just the old folks home deaths in New York, you've reduced that number by many, many, many tens of thousands. And I think that matters because that might, now you're at a severe flu season. And considering the economic damage,
I mean, it is greater than it's been by any other flu that we've seen. I think the 2017 was like 80,000.
It was 85,000, and they reduced it. They reduced it because, again, they reviewed those deaths, which they haven't done with COVID. That's something else that's interesting to me. The flu season is what?
3 or 4 months.
Right, typically, yeah. It's something like, depends who you ask, somewhere between like October or November through March or April, right? And then that's the year, you just cited the year 2016, 2017?
Yeah,
so
2017.
Okay, so you mean 2016, 2017 from that season, right?
Right.
What happens after that season? What turns it into 2017, 2018? It resets.
Right.
We're still counting the same COVID deaths to the total from...
Well, but we haven't even
last
done
season.
a full year, right?
But it would be from that season. It would be from that seasonal flu, right? You would have it from January through, now we're going into July?
Right. Yeah.
So shouldn't that reset
It's
very similarly to the flu?
I'd say so, but...
Well, I don't this argument is really weird. Is he trying to say that, like, by calling it all one season, it's inflating? Does he think it sounds better to say that we've had 2 seasons of COVID-19 where 50,000 people have died every season? Does he think that like is a rhetorical win for him? I don't really understand this point that he's trying to make, or I don't get it at all. Like, that's such a weird... Also, why don't these guys drop me my trough? So I have my second fucking bank. It's pissing me off.
But yeah, I mean, okay, let's say it's about 6 months for each. It's about comparable now. People were saying, oh,
Sure.
back when it was like 50,000 deaths, oh, it's way less than the regular flu, nothing to worry about. Now I think we're at a point now where we do have a bit more data. It'll be interesting to see when we actually go into next fall, when we get potentially the second wave, and then we will be able to compare a full season of flu to corona.
Well, I don't think it should be added to the same total, because right now, like you said, we're already through 6 months. It should reset. Right, if we're going to apply it to standard flu deaths. Now, let me ask you this, because I agree with you. We do have more data. Now, I do think if you reduce it by I'm saying at least 25%, right? And I think we both agreed that those should not be counted as COVID deaths. The ones that I mentioned, the attempted suicide, being hit by a car.
Sure, I don't
maybe
know.
90.
So he's identified 2 like relatively exceptional cases here. So what we've learned is that in Colorado, every person that had COVID-19 at the time of death, until the death certificate is made available, seems to be counted as a death. However, those numbers are expected to converge over time as the death certificates roll in, autopsies are completed, right? He's taken 2 rather exceptional cases that sound like they won't end up being there at the end when things are totally counted, and he's trying to say that every single condition is going to be like that all of them are going to be exceptional. But I don't think that's been adequately demonstrated. It's possible that somebody had a heart attack, they had a COVID-19 as an underlying symptom, but we don't really know if that exacerbated and that caused a death, so it's listed to be safe. But a lot of those probably will end up, even when all the reporting is done, is still being COVID-19 deaths. There might be some number, maybe not 25%, maybe it's overinflated by like 5 or 10% in the case of the death certificates being listed here. Now, we're not talking about all the people that died that weren't counted at all, that did happen initially, that there were a lot of deaths that just completely weren't counted. But for this particular number, for the death certificates thing, it might be inflated by 5 or 10 or maybe even 15%. But we don't know that it's 25%. To get to that 25% number, we literally just knocked off every single death that had coronavirus listed on the that had coronavirus as an underlying condition, but wasn't explicitly written on the death certificate. We think so far, but we don't know that yet, right? Like, he's jumping from like one extreme to be fair, it is an extreme right now to list every single like death where COVID-19 was an underlying condition, to list that on, or to report that federally before we have the death certificate. That seems extreme, but then to go and say, well, we can actually get rid of every single one of those, well, that's just moving to the other extreme, right? We probably have to wait for the dust to settle and for all these death certificates to be finished. Autopsies take time. These are resources. They're real people that we need to do these things. We can't do them instantly. Like,
7-year-old who's in hospice. So we need to be...
He'd be cuspy. I think the suicides and stuff would be good, but I don't know if they'd be 25%. Maybe 5 or 10.
Well, 25% aren't tested at all. So we don't know at all about those 25%. And of the remaining ones where we do have reports, there are a lot of cases like this, right?
A lot.
Right,
It's a
and there's
weasel.
other ones too. There's the opposite.
Sorry, that's no problem.
Where they had some sort of symptoms, heart failure, lung, pneumonia, that sort of thing, but they didn't get tested. So it could have been the other way around, where they did have corona. We just figured it was a regular.
It's very unlikely. And
yeah, they are sampling it more towards the side of.
Would we agree that's because I just had a wife who was in the hospital for a long, and the very first thing they did was test her for COVID and me to visit her. So would we both agree that if someone is going into the hospital, really at any point this year, they are far more likely to be immediately tested for COVID than for pneumonia?
Yeah, probably true.
So I think we would both agree that if you're going to weigh that, the scales would tip in the balance of they're over testing for corona. That's why we have more cases now, even though deaths are going down. Right? Cases are going up, but deaths are going down. So it isn't. I do agree with you that we have more data, and I think we need to. And you tell me if you think. I think that we do need to adjust our approach.
Wait, I don't even know how to use. Okay.
They are far more likely to be immediately tested for COVID than for pneumonia.
Yeah, probably true.
So I think we would both agree that if you're going to weigh that, the scales would tip in the balance of they're over testing for corona. That's why we have more cases now, even though deaths are going down. Right? Cases are going up, but deaths are going down. So it isn't. I do agree with you that we have more data, and I think we need to.
I don't understand his argument there at all.
And you tell me if you think. I think that we do need to adjust our approach based on data.
Okay.
I think that's important.
Yeah.
In other words, I don't think that we should stay as many governors, my home state of Michigan, in perpetual lockdown if the data shows that, well, actually, it's not a 3 or 4 or 7% death rate. It's a 0.3% death rate, as we know now. Right? I think we need to adapt. Would we agree with that?
Yeah, I think I'm at the point now. When it first started, I was freaking out. I'm like, oh man, this is going to be a big fat apocalypse. And part of that was China. And I really think China has undercounted their deaths.
Yeah, they need to be held accountable.
Because they're saying that they're at like 80,000 cases and like 4,000 deaths.
Nowhere else in the world.
Yeah, and it did like...
Is he saying... Yeah, was he trying to say pneumonia is different from COVID-19? Because pneumonia is just a condition. That's like pneumonia is a condition that can be brought on. This is complicated. Pneumonia is a condition that can be brought on by SARS-CoV-2, which is the virus that causes the COVID-19 disease. Like the COVID-19 disease can have like pneumonia as part of it. Pneumonia isn't like a whole separate, different kind of disease. Like pneumonia is like a condition that can be brought on, or it could be caused by a separate bacterial infection or viral infection. Sometimes I think as a result of having the SARS-CoV-2 virus like in your system or having the COVID-19 disease.
Exponential and then nothing.
Right.
So I'm sure that theirs are underinflated.
Cooking the books a little bit.
And that's what made me freak out. I'm like, well, if China's going to shut down their whole economy and they don't shut down their economy for anything, this is going to be really bad. But it looks like now that we've had some time to look at the data, it's not quite bad.
Right.
I would say it's more than a regular flu.
Yes.
I definitely say if you look at like the total mortality charts, which just like add up everyone that's died, that's gone up significantly. So it's definitely had an impact on people dying.
Yes. It's definitely had an impact on people dying. I just think that we need to be honest about the numbers, and the American public aren't necessarily, most Americans, you're more informed than many of them, they're not aware that the 25% of deaths aren't counted at all. They're not aware that states that finally said death from COVID and death with COVID when we separate at 25% reduction. Many of them aren't even aware that probably the foremost health expert on this topic, Dr. Birx, along with Dr. Fauci, and again, it shows us that experts can disagree, right, that she thinks it's 25% overcounted. Now, I do agree with you that it's more severe than the normal.
So this is not true. I think Fauci has said multiple times that the deaths are probably undercounted right now. I'm almost positive that we've... Fuck, I feel like we had this. So this was back in May. Dr. Anthony Fauci says U.S. COVID-19 death toll is likely higher than official tallies. Fauci has not come out and said that we're probably overcounting these or that the 25% shit. I think he meant that Birx and Fauci can disagree. Sure, just being clear on how he expressed this here.
Separate at 25% reduction. Many of them aren't even aware that probably the foremost health expert on this topic, Dr. Birx, along with Dr. Fauci, and again, it shows us that experts can disagree, right? That she thinks it's 25% overcounted. Now, I do agree with you that it's more severe than the normal flu. The statistics that we see, though, what's interesting to me is that it's actually not any more dangerous, not significantly more dangerous than the normal flu for young people.
The White House's Coronavirus Task Force Response Coordinator, Dr. Deborah Birx, said in a recent meeting that there's nothing from the CDC that I can trust. Is this a Trump appointee? Because at this point, honest to God, I don't know if I would believe anything any Trump appointee said. Between what's going on with Barr and the DOJ and everybody that's come out of his administration, holy fucking shit. Jesus Christ. It seems like Trump, especially in line with what Bolton has said recently, it seems like Trump's goal is literally...
Shut the fuck up, movement, alright? It's a stupid fucking meme.
Hi, chat, can I get some wowie?
Winning re-election is the most important thing. Like, absolutely the most important thing. But okay.
People, but significantly more dangerous for old people. Well, now let me ask you this, because remember the initial reports, right? The reason for all of this pandemonium was the Imperial College of London study, right? Neil Ferguson.
Right.
And you remember what they predicted? How many people dead?
Like 2 million or something.
Yeah, it was like 2 million, a 7% death rate. Remember?
Right.
Now,
does anybody have a link to that study? They keep citing this, but I'm pretty sure that was like the most dramatic tail end of things that could happen. I don't think that they were saying like 100% that's something. I'm pretty sure that was like if we do nothing, this is the response. Birx is a pretty big yikes from the way she simps for Trump. Trump is so attentive to the science. Oh, hold on.
In the scenes and in front of the cameras during these daily briefings that we're seeing. What's been your perspective, Dr. Birx?
He's been so attentive to the scientific literature and the details and the data. And I think his ability to analyze and integrate data that comes out of his long history in business has really been a real benefit during these discussions about medical issues. Because in the end, data is data, and he understands the importance of the granularity.
Help
and
me
I
shut
think
the
he's
fuck
been
up,
really
Luton.
excited
All right,
about
it's a stupid
finding
fucking
the level
meme.
of detail that we've been able to now. Because in the end, data is data, and he understands the importance of the granularity. And I think he's been really excited about finding the level of detail that we've been able to now bring over the last few weeks to really understand who's at the greatest risk for severe illness, who will have mild and less and asymptomatic disease, and really calling on every American to do that social distancing, because some people may not know they're actually infected and be unknowingly spreading the virus. And that all comes from the president seeing the data and then really directing these policies and these guidelines.
Okay, this lady sounds 100. Apparently, she was appointed under Obama. Okay, this lady sounds like a complete and total dipshit. I have no idea. Somebody said that appointed by Obama in the administration 2014 as a global AIDS response coordinator, appointed by Pence as coronavirus response coordinator this year. Interesting. She's just sucking up to Trump so she can stay on TV? Okay, I guess. But holy shit.
Who were skeptics said, I think this will be a more severe flu, which has a death rate of 0.1 to 0. Depending on the year, right? Where we had a really bad flu year of 85,000, right? So 2 million, that was the number we used for the lockdown, versus the anti-science skeptics who said, I think it'll be closer to the flu. On that scale, where are we? Do we have a disease that's closer to the anti-science skeptics, as they were called, or closer to the experts who said 2 million?
Yeah, so like on a 1 to 10 with 10 being the 2 million and 1 being nothing, I'd say 3 or 4.
Ooh,
so it's
shut the
different.
fuck
Maybe even less would be a 2.
Maybe.
Yeah, especially if you reduce to 25%. But let's even take that number, 85,000, like you said, 80,000 deaths from a really bad flu season. And let's even take which is what it looks like. But let's say it's 110 or 115,000 now. Here's 80,000. Here's 2 million.
Yeah,
right?
I guess.
So
And I was skeptical of that when that came out at the time too.
Right.
I thought the second round of numbers that they had of about 200,000, which is probably what we're on track for now, seems about right.
If we use the metrics of just counting anyone who dies who has it in their system, yeah.
If Crowder was in LA and posted the address, would you go debate him for content?
Yeah, of course, but he never does this.
Well, and if we get the second wave,
right?
We'll see. Well, probably about this weekend when it goes, 2 to 3 weeks from when all.
Yeah, I feel like the first estimates were like 40K. This 2 million number gets cited a lot, but I'm pretty sure that 2 million was like the very high end of very uncertain predictions. But that guess was anywhere from like 40,000 to 2 million, and that was it. That was like a worst case scenario. Like, people are so bad at stats and numbers. The idea that like you make a projection and it could be one thing or another, and people are like, oh well, we didn't get the worst case scenario, so it was all bullshit. It's like, well, okay.
Shut the fuck up, movement, alright? It's a stupid fucking meme.
These protests have been starting.
You think that might have an impact?
Oh yeah.
Why do you think the media has been blaming it on Memorial Day and not the protests? Not the riots.
Right, they can't admit that it's been the riots that have been spreading it.
I think we would agree on that.
So that'll be interesting, especially around here. Like, Dallas had those big riots the first weekend.
Deep Ellum was trashed.
Yeah.
Completely trashed.
So we'll see pretty soon here what's going to happen. And of course, before that, Texas started undoing the lockdown.
Right.
I mean, as for me, I think we shouldn't have gone into. Well, depends on the state. I think Dallas was okay, but or Texas was okay. Maybe, I don't know. I'm very mixed on the lockdown thing. I'm of the opinion that I think people should be able to go out and do whatever they want to do, but it's not going to be my problem when they get sick.
I understand. Well, then you must be against some kind of a socialized healthcare system.
Yeah.
Okay.
Yeah.
So there you go. So more libertarian. I understand that approach. Yeah. And I think that it's important to note that states that have had lockdowns haven't fared better than states that haven't had lockdowns. Now that being
This was we're done with it now, though. We're done. We're done. The riots are done. The protests are done. There's no more talking now. This was the most that happened.